Ladies and gentlemen, another exciting edition of Beyond the Bar. I'm Zack England here with one of my favorite all time grateful for you friends, Dr. Chris Lewis with Spine Chiropractic. Doc, how are you?
I'm doing wonderful. Thanks for having me.
Love it. Thanks for being on here. This is long overdue, and don't want to take too much of your thunder and your background, but a chiropractor here locally in Chattanooga that has been such a tremendous blessing to my practice on seeing patients, on referrals, and just general guidance. And so, really excited. I don't think either of us, as we joked beforehand, are at a loss for words. So,
No, we're not.
I think we'll keep things flowing, but
Yeah.
unscripted. But that makes it half the fun. So, thanks again for coming on. And for those who aren't familiar with you, if you would just give your background and how long you've been in Chattanooga and kind of what you do.
Sure. Well, my name's Christopher Lewis. I've been a chiropractor over 20 years. Came to Chattanooga right around 20 years ago uh, and put our foundation down. I started working for a big group, and then eventually I moved on to my own practice. And now the practice I have it's integrated medicine too. So, we have a chiropractor, which is me, and nurse practitioner, medical doctor. We all work together to try to get people better. Um, take any take care of anybody, any type of personal injury or workman's comp, low back problems, headaches, migraines. We like the difficult stuff, and the key is just getting the diagnosis right and make the proper referrals when you need to, and get people back on their feet the best you can as fast as you can.
Yeah, I guess we've got a similar trajectory in that we were both with big groups and then ended up going out on our own. How long have you been on your own? Toughest question today.
It is.
I feel like you've been out longer than I've been out.
About 7 years.
Okay.
Yeah.
I think you started your own right as I was leaving.
Yeah, it was
my,
all the
my
same.
previous
And
group.
the funny thing is, we both came in at the same time.
Right.
And I met you at a Christmas party, but
Yep.
we won't talk about that.
That's right. Yeah, exactly.
Yeah, but then that's how the relationship started, and so it's about 20 years.
Absolutely. One of the things I remember, I'd forgotten about this until I was thinking about this podcast, was taking your deposition once on a car wreck case. And I'll never forget the defense attorney. He was an older gentleman. He's had to have passed by now, but was a polite gentleman, but could be just a pain to work with. And I remember taking your deposition for what you call medical proof. And he's, of course, entitled to cross examine you. And I remember him trying to get a couple of digs on you, but you were just cool as a cucumber. The one thing that stands out is one of the last questions he was trying to ask you. It was a mother daughter, I think, combination, and why the child's treated, for not as long as the mother or whatever. Mm-hmm. I remember he just looked at him and said, "Pretty easy, man. Kids heal faster." And you just kind of stared at him, and that was it. Deposition was over. So
I totally forgot about that.
Yeah, I mean, and it wasn't you being a smart aleck. You just said, "Yeah, that was the easiest one of the day." So
that was good. That was a
yeah,
good one, man.
absolutely.
I forgot about that. There was another one time I was getting deposed, and so it's good cop, bad cop. They go back and forth, and you try to just answer the question. Don't lead into it too much. And the guy just wouldn't stop. He was just like, "Oh, this. Oh, you're saying this. You're saying this." And I just stopped and looked at him, and I was just like, "No, you're saying that. I'm not saying that. I said yes. That's what I said." So,
right.
But yeah, you have some pretty interesting stuff when it comes to doing depots sometimes.
Yeah, sometimes you either have it or you don't. I know there's a lot of there's some chiropractors, some doctors, whatever you want to call it, they're just super uncomfortable being under the gun. Don't think you're one of those.
Yeah,
so nothing seems to rally you.
Because I know when we leave, everybody's getting an elevator and somebody's buying lunch. So
that's right. That's exactly it. So, how did you get your passion for chiropractic? What led you into it?
Mm-hmm.
What's your story there?
It's kind of weird. When I first went to college, my whole family's medical teachers. My mom, she was one of the top cancer nurses. She helped open like 4 or 5 cancer centers up north, and she always wanted me to be a hematologist, and I was like, I'd rather be a trauma surgeon. And then when I went to college, I was just like, you know what, I'm gonna do corporate law. You know what I mean? Because I had 4 years of accounting, I had all this stuff. I was like, yeah. But then I found out how to take accounting again. 4 more years of accounting. I was like, I'm done with this.
Yeah.
So I started doing pre-med. I was just like, you know what? I'm gonna do trauma surgery. That's because I'm high strung. I like moving all the time. And when I was young, when I was very young, I was 5 years old. I had chicken pox and I scratched it and I got staph and it went all through my body, collapsed my lungs. I was hospitalized for like 3 months. I had to learn how to walk and talk.
How old were you?
5.
Oh God.
Yeah. They gave me my last rites 4 times. Like, yeah, it was horrible. So they had to cut, I had like 11 surgeries. So I have a scar from here that goes up under my shoulder blade with a bunch of tubes. And after high school, I played a lot of sports. Next thing you know it, my shoulder just kept hurting. You know, my shoulder blade. And then the other thing is ever since I had that lung problem, I always had asthma, and I always wasn't breathing good, and I always had to take inhalers and stuff like that. And so my back pain, where my shoulder blade was, just got worse and worse and worse. I went to orthopedists. I went to physical therapy. I went PCP. They sent me somewhere else, lung specialist too, and they couldn't figure out what was wrong. And then one of my friends goes, "Yo, you need to go see my friend's dad. He's a chiropractor." I was like, "I ain't going to see a witch doctor." Like, I guess I didn't know anything about chiropractic,
Right.
you know?
Yeah.
And so I go into I go in to see this chiropractor, and he asked what's wrong, and I was just like, "Dude, my shoulder blade, like it's so painful. I can't carry anything, like my book bag, you know, to school, and I kind of feel lopsided, you know, like when I walk."
This is high school now.
College,
Oh, college. Okay.
first, second year.
Sure.
And then he was like, "Well, let me check you out." He goes, "Why do you feel lopsided?" I don't know. I was like, "Felt like my one leg shorter than the other," and you know. So he looked at that. He was like, "No, you're right on." He adjusted me, and then he checked me out. He did all this stuff. He goes, "I know exactly what's wrong with you." He was like, "But I need you to lay down and totally relax." And I was like, "All right." So I laid down, and he basically palmed my shoulder blade, and he adjusted it. But I've never heard anything like it ever, even to this day. Actually, relocating somebody's arm, this probably sounds like it.
Yeah.
But it went like weird. What it was is I had scar tissue from my surgery and stuff adhering to my shoulder blade, so it wouldn't move it ever again. It wasn't moving right. And he did that, and it got all warm. I was like, oh, and I felt good movement, and my breathing problems went away. My mom took me back to the lung specialist, and because she found in my drawer, she found all my inhalers, all my medications. And she was like, "You haven't been taking these?" I was like, "No." I was like, "I haven't needed them."
Yeah.
And so she took me to the lung specialist, and he was like, "Oh, you grew out of it." But it was funny. It was right after he did that to me. My shoulder pain went away. My breathing problems went away. I never had asthma again, never had to do an inhaler, nothing. And so I sat there and contemplated. I was like, you know, there's more to making yourself healthy or trying to be as healthy as you can than it is to try to fix a disease. Because they weren't fixing me. You know, just that one visit. You know, I've seen them more after that, but just that one visit changed my whole trajectory of my life. You know, my not having to go to all the doctors, not spending all the money on that medication, being able to go jog with my girlfriend without, you know, any problems, all the way up to where I am at now. You know, it totally changed my whole trajectory of my life. And as I was contemplating what to do, I had this friend. You can look him up. His name's John Casera. He's pretty good chiropractor up in Pennsylvania. Everybody loves him. But he was going to the same school as me, and he was just like, "Dude, do you get this chemistry and this physics stuff?" I was like, "Yeah." He's a big builder. He was like, "Can you just help me teach me some stuff?" He was like, I was like, "Yeah." So we'd hang out and we'd do stuff, and then he was just like, so what are you doing, man? I was just like, well, I'm going to go to med school. And he was like, dude, why don't you come down to chiropractic school? Out of nowhere. And I was just like, well, how am I going to do that? And he was just like, here, let me tell you what schools are the good schools. And I'm going down to Atlanta. I'm graduating this year. And, you're done in about a year and a half. So just give me a shot. And I was just like, all right. And then I told my mom I wanted to be a chiropractor. And she was like, no, you ain't doing that. You're supposed to be a hematologist.
Yeah.
And then I graduated and then called John Casera. I still had his phone number. And he was like, dude, I'll find you an apartment. And so me and my girl moved down to Atlanta. We had $3,000 and I paid for rent for 2 months. And we had a black and white TV, no furniture, bedroom set. And I had a PlayStation. So I'd lay on that floor. I'd play that PlayStation. And but we both got jobs, and then everything started moving. I was in chiropractic school. We only had one car, so I hitched a ride with somebody there and back.
Yeah.
And did very, very well. I think there was like 15 quarters. I was on Dean's List, 14 of them. So
Nice.
yeah. And then after that,
A few more than I was.
it's all right. But then after that, I went to Carrick Institute, and I got over 300 hours in chiropractic rehabilitation for neurology and stuff. And I'm able to take my diplomat if I take the test. I just never did because
Sure.
it's like $4,000, and you got to close your office. And then I advanced a little bit more and started working on a diplomat in orthopedics. And that's when I was like, got to get a nurse practitioner and medical doctor because there's a lot of stuff that we could do that that most people can't do when they get injured, like personal injuries.
Yeah. And chiropractic school's 4 years, right?
Yeah, it's 4, but then somebody like me, I did 5. I liked working more than finishing it sometimes.
Yeah.
You know what I mean? So,
absolutely.
yeah.
And it's funny. I feel like a lot of people that are hesitant to go to a chiropractor, I've always told them be careful. It's addicting. Like once you get in, just something feels better.
Yeah.
And it's not a magic bullet for everything, but I think it definitely completes a big part of the puzzle.
Mm-hmm.
And as I get older and heavier and need those oil changes more, just
you tuned up in WD-40.
Seems to come at a good time. People always ask, or we talk, what's your favorite adjustment? And I don't know the correct terminology, but it's the one where like you cross your arms and the chiro basically
gives you a hug.
Bear hugs you and like drops you back.
Yeah.
That seems to get the best response, at least out of me. The ones where like I'm on my side and the hip stuff, I always feel like I'm falling off the table. It just never seems to work. But
it makes people nervous.
Yeah, exactly.
I'm just like, it's just a foot. If you fall, you'll be okay.
Exactly.
I've only dropped one person.
Yeah, that's right. That's right.
You learn from it.
And so, how did you get out of school and then you make your way to Chattanooga?
Yes.
Right. Okay.
Well, no, actually, I was in Dalton for a little bit.
Oh, really? Okay.
Yeah, I worked with this consultant group, basically.
Nice. Okay. So you were in Dalton 20 plus years ago, however it was.
Yeah. No, I've been in Chattanooga 20 years. So I was there for, I don't know, between 5 and 8 years before I came up here.
Wow.
Yeah.
And Dalton is its own world. It's definitely an ever evolving own world, but it was definitely its own world back then. And
it's totally different. And like, you can't judge a book by its cover down there.
Absolutely.
Yeah, because the old guy that's driving up in the old beat up pickup truck actually owns like 18 businesses.
That's right. Yeah.
You know what I mean? Like you would never know.
Carpet mills left and right.
Yep.
Yeah. Yep. Absolutely. And so with your practice now, are you, I hate to use the term pushing meat, but like, are you're hands on every day seeing patients?
Every day.
Yeah.
Well, Monday through Thursday till 6.
Right.
Yeah. And, because everybody got their own schedules because what you have is you have new patients that come in that you have to work with and, examine them. And, sometimes you might have to do x-rays or MRIs, and then you also get referrals. So, workman's comp and then you also have, you got to deal with getting people with MRIs and hooking them up, referring them to the right doctors for, certain types of injuries like pain specialists. Because sometimes you can't fix everything, but we can do a lot. So yeah, it's hands-on. And my nurse practitioner is there a couple days a week, and she can do the more advanced stuff in case we need it. She thinks it's right. So.
Sure. And it does seem like one of the true benefits of your practice is the willingness and openness to work with other doctors, not
Yes.
trying to be a, you know, catch all, fix all. I don't need anybody's help.
Yeah.
You've always seemed to have a gift of being able to work and coexist with others. And
Yeah.
not to coin the term, it takes a village, but you
Yeah.
do seem to embrace that to where everybody can help each other.
Yeah. 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 Yeah.
And that I wish we had more of that in the medical community, not just in the chiropractic level, but that really seems to be one of the true gifts of your practice.
Yeah. And I always tell young docs, stay in your lane, because
Yeah.
that's, the way people look at it.
Right.
But what it mainly is, the way I look at it is, uh, doctors don't reach out to other doctors. Okay. So I'll give you an example. Because, you have your PCP, and then they have to, if they refer them to a specialist, and like everybody keeps talking and they make a plan. So most chiropractors, they come up with a plan, but they don't think about other things. So like I had this patient one time that had saddle numbness, okay, numbness in the saddle region. And that's an emergency in my head, So I ran an MRI of his back, nothing. And so I know there's sensory components that come down through the neck that go down to that area. Did that, nothing. But they did find in his brain he had some plaquing going on. And so I was like, well, let me get his PCP on the phone. And so I just called her. And I was just like, look, this is what I'm dealing with him. Everything's negative right now, but he does have some plaquing, in this area. And she was like, okay, we'll take care of that. And you just keep following up, doing what you're doing. And just let me know what's going on, and I'll let you know what's going on with plaquing. So they did some tests. His plaquing was fine. I think it was his pineal gland. That happens with some people as you age. And couldn't find exactly what it was that was causing that numbness, but diet and helping him with diet, and then he started exercising, getting adjusted and stuff. It slowly started going away, and then boom, but he had it for 10 years.
Yeah.
But nobody jumped on it. But to, his PCP was fine to work with him. You know what I mean? But if you don't reach out and either that or ask questions, you know what I mean? Because if you don't ask another doctor questions, then how do you know how they work?
Right.
And that's the thing that doctors miss, but it's in every profession. You know
Sure.
what I mean? Like when I was in Dalton, all the pediatricians hated each other. So
Yeah.
you know what I mean? So it's like,
Yeah.
and then when you go speak in front of people and you speak in front of doctors,
Sure.
there's humble ones, but then but if the trauma guys, they're gods. They
Right.
do everything.
Oh yeah.
You know what I mean? So,
Absolutely.
but that's how that works.
Yeah.
It's
And I've heard the stories where you have the baby that's just been crying nonstop
Yeah.
for a month.
Yeah,
and
yeah.
The parents are exhausted,
Yeah.
and I've seen some videos too where just kind of a slight adjustment, all of
Yeah,
a sudden
real
the baby
tiny.
just kind of calms down. It's
Yeah, yeah.
it's the craziest thing.
Yeah, there's the main thing with babies is colic. Colic's
Yeah.
number one. Yeah, and people can look it up. They'll call it an osteopathic adjustment. I don't care what you call it; it's still an adjustment.
Sure.
You know what I mean? There's that, but then earaches too. But
Yeah.
then after that, babies until they start walking and falling on their face, they're pretty good.
Yeah.
They're pretty strong. And then, but the other thing too is when you take care of babies, I'm a father of 4, so I've been through it. Baby that won't sleep at night all the
Yeah.
time, and then, the one that wasn't walking when he was walking, and so I went through a lot of stuff. So, I can give some good advice when because I have a lot of patients that will refer a baby that's all colicky but not find anything wrong with them. But then I tell them, I was like, let me tell you what happened with me. I had a baby that wouldn't sleep, and would kind of be colicky and just like all the time. I bought everything to shake the bed to make him feel good.
Yeah.
This and that, wouldn't work. I was like, I'll give you some advice now. You guys got YouTube now. You can just turn on a hair dryer and just set it next to him with the YouTube on the phone. I was like, that can calm him. But the weird thing what happened is I told my wife, I was like, yo, do a food diary. And she started doing a food diary. And in this food diary, uh, we found out anytime she drank coffee or ate an onion or broccoli, baby cried all day. And I was like, start eliminating that. And so she quit doing it. Baby quit crying, started sleeping all night. So like, so being a father too, just being able to give, patients advice, pediatrically, um, that helps too. Cause it's not always something simple. Sometimes it sneaks up on you.
Yeah. Makes total sense. How does your own doctor, how does your primary care doctor feel about you being a chiropractor? Are they on edge, or like feel like you're kind of judging them or watching them?
No, I got a cool doctor.
Yeah.
Am I allowed to say his name?
Yeah, absolutely.
Yeah. Dr. Baseman. He's the greatest. Because he also like he'll talk to you and sit with you and listen to you, and then guide you spiritually a little bit.
Yeah.
You know what I mean? I love that stuff. And but anytime he sees me, I like break a rib, right? Fell off a building.
Yeah.
And no, he respects me. You know what I mean? But he's like any doctor, he's there to help me.
Yeah.
You know what I mean? Because I'm there. And but when doctors work with each other, it's kind of funny because straight to the point. And but if I don't know, he figures it out. You know what I mean? Like I had an injury one time, and I thought my liver was coming out. I thought I broke my ribs. And, he did all these tests, and basically told me I tore a chest wall when I injured myself. So nobody would figure that out. I was at the emergency room. I was here. I was there. But he figured it out for me.
Yeah.
Kind of funny though is when I went in there, I had this brace on real tight because I couldn't walk because I tore this muscle and I herniated 3 discs from a fall. That's another injury.
Jeez.
And so I went in there, and you know how they do triage. So they go in there and they do triage on me, and they were doing took my blood pressure, and the lady was like, "You must be really hurt." And I was like, "Yeah, I'm hurting. I can't like do anything."
Yeah.
And she was like, I was like, "What was my blood pressure?" And she was like, 170 or 120. I was like, "What?" I was like, "No." And she was like, "I'll be back in 10 minutes." And I was like, "All right." So I'm sitting there.
That's pretty high.
Yeah, I know. I'm sitting there. I'm like, "Oh, it doesn't hurt that much." Yeah, it does. No, it doesn't. And then I was like, "All right." She came back in, and she took it. It was the same blood pressure. I was just like, "I'm not having a stroke here."
Right.
And she was just like, "Well, your blood pressure is really high." I was like, "Oh, wait, hold on a second." I was like, "I got a brace on." Went, and she took it and went back to normal. But I totally forgot I was wearing a brace. But that was a funny experience because he came in and he was like, "That was a pretty high blood pressure there, buddy." Yeah. We almost called an ambulance.
So who's treated you for your herniated disc? Have you kind of?
Oh, it's so I got. So basically, what happened was we had that ice storm. I'm originally from up north, and I cleared off my I had like 4 brick stairs that come up. Totally cleared it off, and took all the ice off. And what happened was, I went inside. I was like, "Whew!" And my wife's like, "Oh, go get the baby from the sleepover." I was like, "Okay." So I ran out to the front porch. I guess something dripped, and right when it dripped, it was instant frozen. I slipped, and I hit so hard. I said, "Help!" And nobody could hear me. I was just like, "Oh!" I went to get up, and I felt like my back was scratched really bad. And so I walked down to my car. I go to get in my car, and I feel my tissue from my glute tear away from my muscle.
Yeah.
And then I was like, "Oh!" I was like, "I still got to go get him." And I was just like, "Okay." And then I turned on the truck, and I was in shock. I didn't even know. Because, people talk about shock. I looked at my steering wheel. I was like, "Do I know how to drive?" You know what I mean? And I was like, this weird shock. I was just like, "Oh, if I back up, I can do it." So backed up, and so that's where I had to do the brace. But he had to run all these tests, and that was pretty messed up. And I also went to physical. I had to do physical therapy. I got steroid shots from my staff. I had to do a thing called spinal decompression, but I couldn't do it till that muscle healed. and and so that kind of messed me up for a week. So it was from December until, I'm not even kidding you, 2 months ago, I still had pain in my low back and my leg was still kind of numb. This is out there, man, but we did stem cell injections in my back.
Yeah.
Yep. And 2 days later, that numbness started going away. I still have a touch of it, but it's changed totally in the past 6 weeks. So it was,
Very interesting.
yeah, it was pretty
Yeah.
interesting. I was absolutely shocked, actually.
Are you a big decompression advocate?
Yes.
I've had it done in the past. I do notice a difference.
Yeah,
It's
I do.
nice.
Yeah, yeah, it's very nice. Yeah, because discs, they have hydrostatic pressure on them, because they're like 95% water. They're like a jelly-like substance surrounded by a tire that holds it.
Yeah.
And what happens is, you know, it protects you from impact, up and down. But when a disc swells, that pressure starts going out. So when you decompress it, when you stretch it apart, it pulls it in. But also, like when we do our decompression, we just say we had it on 90 pounds, for example, we'd do a 90-pound high and an 80-pound low. So pull it high, let it go down a little bit, pull it high, because discs imbibe fluid, nutrients from the outside, kind of like a wet sponge. So if you're moving a sponge, fluid goes in and out of it. Kind of does that through the vesicles in the bone. So if you add adjustments and then you add the decompression to it, that's, you can, that's best practices the way I look at it, because the next best thing you can do for that is you're starting to decompress the disc with needles, and then after that is decompressive surgery.
Yeah.
You know what I mean? So, you know, adding both of those, and then when you get the patient to a certain point where they're not so acute, you can have them do stuff. There's ways. There's different orthopedic tests that you can do and figure out what movements make them worse, what movement makes them better. Then you just give them exercises to either do in the office, at home, or send them to physical therapy. Because some people, they'll be like, "Oh, I'll do them at home," and they don't want to do them there, and then you're like, "You're going to physical therapy," because I know they're not
Keep them
doing it.
disciplined. Yeah.
Yeah, exactly.
Yeah.
Yeah. So
What chiropractic mechanism treatment plan do you find most? Let's keep it with car wrecks. Do you find most beneficial for somebody in a car wreck? Is there a general just go to for really anybody that's been banged up?
like for visits and
Yeah.
stuff like that. Yeah. I follow. There's this thing called WAS, WAS. In Canada, they wrote, basically they did studies on the classifications of type of injuries that you got. So, like a class one would be a knee strain, fender bender, my neck hurts a little bit, but after that, case two or class two, something tears, sprain, strain bad. They have headaches or nerve pain after that. When you start to get to stage three, I'm usually not seeing them as a doctor. They're probably at the hospital getting surgery. You know what I
Sure.
mean? So I look at that, and then I look at how your body heals. So, when you look at muscles and tendons, 4 to 6 weeks. When you start getting into ligaments, that could be 6 to 12 weeks. So if it's a simple problem, most simple problems, I would say 6 to 12 visits. You know,
Yeah.
and then give them exercises. The complicated ones, they can take 2 to 3 months, and it's not just you. You have to get the tissue functioning good, but then once you start hitting that WAS class, class two,
Yeah.
you have to worry about chronic pain syndrome after that. And so, you might get them moving the best they can, but they're still having pain. Once you hit 3 months, you're into chronic pain syndrome. So you have to get them to a point where you can try to get them to exercise, get that tissue working good to get through that, because residual pain can last up to 3 months. But once you get over 3 months, you start getting into the chronic pain thing, and that's when the referrals start coming out.
Yeah.
You do what you can, and once you reach that certain point, and they're still having a lot of pain or more than what your average would be, you might have to send them to a pain specialist or a neuro guy You might have to do further testing. So, but yeah, that's basically so the different classes, and then once you know, simple class or complicated.
Okay. Non-car wreck, you just seeing somebody on a somewhat routine basis. How often do you want to see an established patient? Once or twice a month at a minimum?
Yeah, well, if it's acute, once or twice a week. Some people come 3 times a week actually if they hurt really bad. But if they're just trying to stay tuned up, you know, everybody's different. You know, some people you see them once a month, sometimes once every 6 weeks. But you know, I got guys that lay slab. You know, they come in, you know, whenever they can.
Oh, yeah.
If they get off of work early,
Sure.
then you go adjust them. And it's like pigpen, dust everywhere. You got to clean everything. But you know, the other thing too is your weekend warriors. You know, pickleball keeps me in business. If it wasn't for pickleball, I think it'd be because these guys,
Yeah.
because they start playing, and they're like, "Oh, I'm gonna reach." You haven't reached in 20 years, my man.
Right.
You know, I mean, they hurt the shoulder.
I've never thought about that. That's got to be a chiropractor's dream.
Oh,
It's
it is. It
pickleball.
is.
Yeah,
Yeah.
my father plays all the time now. I'm
Mhm.
not totally sure how he does sometimes.
Yeah.
Just given the brutality of the sport
Well,
as
that's
far
what
as
it is.
reaching and
It's,
moving.
it's
Yeah,
like, you know, they do the reach and they actually do a split and tear something. You know what I mean?
yeah.
Like,
And with all due respect to the demographic, it's an older crowd
yeah.
in a lot of
Yes.
ways, and so this
Yeah.
is key. I guess we need to send that Revolve Center in Cleveland maybe a gift basket
Oh,
for
yeah,
all the referrals you may be getting.
exactly. Because
So
or the funniest is one of my patients, actually two of my patients recently was like, my wife wants me to start playing pickleball with her. And I was like, well, did you ever play anything? He was like, yeah, I used to play tennis. I was like, when was the last time you played tennis? They're like, oh, 10 years ago. I was like, well, whatever you do, don't reach too fast or try to hit too
Right.
hard until you start getting comfortable at it. You know, you're comfortable at it. And then, yeah, it's not even a week. They come
Yeah.
in, they're like, I can't raise my arm. I'm like, get over here. Let's go figure it out. Like,
Yeah. I know College Dale has a nice
Yeah.
pickleball base. I'm still hanging on to tennis as long as I can.
Mhm.
I've aged out from singles to doubles,
Yeah.
and I believe the next step is to go from doubles to pickleball.
That's
So
it. Dude,
you may see me as an established patient.
I love tennis, and I quit playing tennis because everybody said they could play tennis, and they can't.
That's right.
Yeah,
Yeah. Yeah, it's definitely an acquired skill. You know, if you get out with a newbie, they hit it over the fence, or
All
they
the time,
can't get it
yeah.
back in. So you're just, yeah. Pickleball has been a great equalizer
Yeah,
in the
it
tennis
has.
game. You know, I'm still, you call me a tennis snob, I don't know, but that's still my first passion. So
Yeah,
I'll ride it as long as it.
I think it's
it'll let me.
impressive how fast it's grown.
Yeah,
You know what I mean?
it's really
Yeah.
nice. I'm trying to remember the first time I even heard about pickleball, but it just came
It's
came
just-
overnight.
Yeah, it was like one of my patients. You know, I have a patient who, me and her, we sat down about she's a pickleball player, and she's Seventh Adventist too. So she like, but she used to be a chef, and she's an awesome woman. Her name's Mary Lee Jacobs, and we were sitting, we were chit chatting, and I can't remember. I can't remember if it was her idea or like we just bounce ideas off each other. But there's a big plot of land in where's just outside of Collegedale, Appson area right there.
Okay.
And I was just like, imagine if we just built like a huge pickleball court, but then like there was a clubhouse that was open where you served good food and like smoothies and like just good stuff.
Yeah.
And but then you had like little things like kids can play, like the ring toss and stuff like that. So people can come, the kids can play, and then everybody
Yeah.
had their pickle stuff. And that dream ran in my head for a minute, and I was just like, and then I can have a chiropractic office right there.
That's right.
Give me a business.
I think I mentioned on a previous episode I wanted to open up a sand volleyball court bar.
Yeah.
So I'm going to do that and further facilitate your business because anybody out there bouncing around the sand is going to pay the price. So.
Yeah, we used to when we were younger. I had my crew. You know, we grew up in this certain block, and then I played sports. I played football, soccer, baseball, fencing, track and field. I played a lot of stuff. And there was this one guy that was always on the same, play soccer with me, we'd wrestle, whatever. And so then he had his crew. So when we got in high school, it was so funny. My crew was friends with everybody. They were just like the jock crew, but it started off on Thursdays in the winter. Somebody'd be like, "Yo, my crew against your crew, we're going bowling." We're like, "Yo, bro, go ahead." And they'd come bring their girls, and we'd have our girls, and we just bowl.
It was like Grease.
Oh, yeah. But no, it was funny. And then in the summer, it was, "Yo, Scotts Park." I was like, "What's about Scotts Park?" "Yo, volleyball. Loser buys the keg next time." We're like, "All right." So everybody brought their own beer. They lost 3 times in a row. Each time they had to bring a keg. It was so much fun.
I see the vision now. We have a half pickleball, half beach volleyball facility with a chiropractic office in the periphery. So.
And you're advising people.
Yeah.
No, that's against the law, everybody.
That's right. You mentioned seeing kids, babies, etc. Anybody you just can't see, don't want to see? I mean, you're seeing somebody from age 1 to age 90?
I have patients 96, 97 years old.
Wow.
There are some people that I can't. It's not that I want to see. That I can't see. Like I had a 85-year-old gentleman coming in has been complaining about neck pain for 10 years, and then an X-ray and his neck's half dislocated. So that means car wreck, you're dead. You know what I mean? Trip and fall, you're dead. So,
Yeah.
so you got to refer those people
Yeah.
out. Or, a wonderful vascular doctor here in town. His name's Chris Lassar. He owns all the VICs, Vascular Institutes. He early in my career, I was with the group and I had Chris come, and I find I find like different things on people, but Chris showed everybody how to easily aortic aneurysms, and because I would find some, but he taught us all how to coolly find some.
Yeah.
You know what I mean? So somebody comes in with back pain, and I lay my hand right here on them, and it's bumping up and down. And they smoke for 35 years, and I do an X-ray, and between L4 and L5, I see this shadow. And, that's aortic aneurysm. Oh, you're going to Chris.
Good to go. Yeah.
You know what I mean? So like, there's
Sure.
certain things you can't do, like dislocation and stuff. But like age-wise, I take care of them all the way up. I even have people that come and they'll just sit in the wheelchair as I take care of them because they can't stand or get up.
So young, old, car wrecks, weekend warriors, you're going to see them all. As we wrap up here, what's the best way for somebody to find you, both online, geographically?
Yeah, you can just Google Christopher Lewis, chiropractor or spine chiropractic. There's another one, spine and joint regenerative medicine. We're all the same thing. That's probably the easiest. Or you can give us a call at 423-541-7700. And just make an appointment. Or if you have any questions, we even have people that come in. When I do a consultation, it's free. Like I have patients that are scared. You know what I mean? They're like, "I've never been to a chiropractor," or this and that. You can come in and talk to me for free, and then we'll figure it. And then what I do is I talk to them and I tell them what options and where they need to be looking. Even if I can't help them, and but eventually they're like, "Oh, okay, I'll do this."
Yeah.
So
Got the trust factor.
Yeah. Well, you got to do that because
sure.
Well, trust factor also comes with like I have patients. I had this one patient come in. She was very messed up. She went to Cleveland Clinic, to Vanderbilt, and she kept having this like pain in here, this area of her body. And I did an exam on her, and she was like, "Did you look at my file?" I was like, "No, I'm thinking with my head first. I'll look at your file when I'm done." Yeah. I tested everything. I was like, "You know what? You just got a real tight psoas muscle. What I want you to do is do these stretches 3 times a day for 2 weeks, and then get back to me if it's not better." She stormed out, went up to the front desk. "What the heck is this?" He said, "I've been here, I've been there." And she was like, "He just told you to do some stretches." "Well, how much do I owe you?" She was like, "Nothing. He just told you to do some stretches." And so she left, and 2 weeks later she called and she was like, "Oh, that pain's gone. They're about to do exploratory surgery." And I was like, so you just have to have somebody look at it a little different.
That's right.
Yeah. So, but yeah.
Well, Chris Lewis, spine chiropractic.
Yeah.
If you can't help them, you'll get them in with somebody who can, and comes full circle.
That's right.
Wow.
Yeah. Yo, much appreciated. This is wonderful. Invite me back again.
Absolutely.
We got some fun.
Doc, thanks again.
All right, man.
Have a good night.
Yeah, you too.